these are some of our patients. You might recognize some of them. And then hopefully you're going to end up with some take-homes. One of the things, I was in my Portland practice last week, and one of the things that you're not going to see that came to mind while I was up there, so there was an 18-year-old cat who came in, and the owner said that she was kind of grumpy, and she was clicking on the floor when she walked. So we wrapped her in a towel because she was a little bit anxious, and looked at her feet, and her nails had grown all the way around and were embedded in the pads of her toes. So that reminded me to remind you to check your cat's nails. Cats, when they get older, don't groom as much, they don't scratch as much on their scratching post, and those nails grow, they have layers. And when a cat scratches on the scratching post, we get rid of those outside layers, and if we don't get rid of those outside layers, they'll go all the way around and into the pads. So this cat had a couple of abscesses and some really painful feet. So I'm not going to show you that, but I wanted to mention it because it was one of the things that came to mind while I was up there. Betty Davis said, old age ain't no place for sissies.
Yeah.
I had a senior cat who came in, and he was rather suddenly not using the litter box. So I asked the owner to take a picture of where the litter boxes were. And this is the picture. So in order for that 17-year-old cat to negotiate this whole environment, he had to go out through the cat door into the garage, negotiate all of this, and jump into one of those two covered litter boxes. So you can imagine that he didn't have any real health problems. There weren't any, it was just becoming very difficult for him to actually get to where he needed to go to. So we're going to talk about the whole cat, what lifestyle is like, what relationships are like, and we're going to talk about cat food a little bit too, because there's some changes in how we think about cats now in terms of how we feed them. And we'll talk about a little bit about that. And then I think what I'm going to do is at another time we'll do a whole hour on cat food, because it's one of the most confusing things about feeding cats, even for me. Reading cat food labels and nutrition claims and understanding how to feed a cat is becoming increasingly difficult as more and more people get into the cat food business. And of course, they're all big food people. These are all owned by Mars and these gigantic companies that make human food. And sort of as an aside, they make these other foods and make great claims about them. Whether they're true or not is something that we'll have to talk about.
Dr. Collin, may I offer a remark to buttress your comment?
Sure.
So, recently for one of our cats, we're changing his food from one Royal Canin formula to another. And on the label, there are two designations of the calorie content. They are 3 times different. One is, in the can it says roughly 150, the other says, I can't figure it out. It's the same food, it's the same label, it's the same can.
Yeah,
what is one in French or something?
Well, they label it, and when you read this stuff, it gets pretty complicated. You're right, but it's best to use the thing that you recognize, which is how many calories per can. But it can be very confusing, and because a lot of these companies are international companies, a lot of times you'll see things in multiple different units of measure and stuff like that. So we're going to talk about what aging is. Thank God, old age is not a disease. I hear a lot from clients. They say, well, you know, he's getting old, he's just slowing down. You know, and they use that as an excuse to explain away behavior that may or may not be really normal. Cats really need to manifest all the same behaviors throughout their entire lives. They are solitary hunters. They are, and as such, they hunt in a way that's very interesting. They hunt by themselves, and they hunt in big spurts. Hi, come on in. That's okay, come on. So they hunt in these short spurts, and they hunt alone. So people who say to me, my cat doesn't want to play anymore. Well, how long do you play with your cat? Well, I had a whole hour, and she would only play with me for 2 minutes. Well, cats only play for 2 minutes because they only hunt for 2 minutes. So intermittently playing with your cat is a good exercise for them. It's very stimulating, and they do it their whole lives. They're the same cats as they were 10,000 years ago when they started coming into our houses. In fact, a lot of people claim that cats really aren't domesticated at all, that they were only partially domesticated. And the reason they say that is that the cats, if you turn them loose, if I turn my dog loose and let him just go, he'd die. He'd starve to death and die. cats, not so much. You turn a young cat loose because they get spooked in the yard or disappear or whatever. Those cats will revert to their old behaviors in a very short period of time. And they'll learn how to hunt for themselves, and they'll actually do just fine. Gloria has some outside cats, and those cats probably do a fair amount of manifestation of that over the course of time. These, all of the pictures that you're going to see, you might even recognize some of them. They are all patients in one form or another. So we don't have as good an immune system when we get older. And chronic illnesses that come along with being older also decrease our ability to fight off infection. So one of the things that people say to me is, well, why should I vaccinate my cats anymore? My cat's 16 years old, goes outside, never goes outside. Why should I vaccinate him? Well, it's because it's for the same reason as you're invited to get a flu shot, especially if you're over 50. Because your immune system doesn't function as well as it used to. So while it's true that there might be somewhat less exposure to diseases, the fact of vaccination is really important for the same reason it is for young people, very young people, children, and people with an immune system that doesn't work as well. And older people, we see them not grooming as much. Their skin becomes a little bit thinner. They don't hear as well. They develop what we call lens sclerosis. Your ophthalmologist calls it cataracts, early cataracts. We call it lens sclerosis because cats develop cataracts differently than we do. And if they have cataracts, it's really not normal. For us, all of us, it's normal. But real cataracts in a cat isn't really a vision change. It's a different form of the loss of vision. But they have this sort of drying out of the lenses, similar to us. And so they see a little bit less well. Their hearing starts to go.
Sorry, what was that?
Their hearing. And I fell for it. I'm taking this much too seriously.
I'm sorry.
No.
I couldn't resist. I didn't want to.
We know from a study done by a group of veterinary radiologists that every cat over 9 years old, just about, at least 92% of them, have some evidence of degenerative joint disease or arthritis. So we know when people say to me that their cats are slowing down, well, they probably are slowing down, but it isn't because they're older, it's because they're not as comfortable as they used to be. So things change. They change for all of us. We see some weight loss as well, and we're going to talk about that and what that really means, because one of the ironic things is that from the time the cats are about a year old until they're 10, you've heard me say over and over again, you really need to restrict the calories. Your cat's getting too fat. Here are all the reasons why that's not a good idea. And then suddenly they turn 12, and I'm starting to worry about the weight loss. So we're going to talk about why that is. It's a normal thing that happens, but we have to feed them differently in order to compensate for that. And dental disease is certainly a big deal. If you never brushed your teeth or never saw a dentist, you would really have some severe dental disease. And that's the condition that a lot of these cats are found in. And people will complain simply of bad breath because cats don't manifest dental disease the way I do. I mean, if I have some pain in my mouth from a cracked tooth or something, the first thing I'm going to do is get on the phone. No, the first thing I'm going to do is complain about it. The second thing I'm going to do is get on the phone and make an appointment. Cats don't do that, and the first thing that people say to me when I say your cat has some really significant dental disease, the first thing they say to me is, he's still eating.
Yeah.
Well, of course he's still eating, because he has to. Cats are pure carnivores. They need to eat small, frequent meals throughout the day, and the fact of the matter is that they will conceal any kind of symptom, and they'll continue to eat despite the fact that they have some real severe pain in their mouth. Oh, what happened there? All right, what happened to my, let's see if this works. There we are. The other thing, and what I did in trying to create this talk was try to remember the things that people have said to me over time about their senior cat, to try to explain some of the things that I explain every day as I talk to people about cats in their teenage years. People will often say to me, I can't anesthetize my cat, he's too old. Well, if you take proper precautions, and think about human medicine, think about your last experience at Enloe or somewhere else. At what age do you suppose most surgeries take place in humans? Seniors.
Medicare.
Yeah. So what do? They work you up. You have an EKG, chest x-rays if they're needed, blood and urine, blood pressure measurement, and they're going to hook you up to all kinds of devices, and they're going to try to keep you warm. So what we do is exactly that. And anyone who deals with senior cats will take these kind of precautions. Sometimes they'll put you on a little, if you have a little bit of lung impairment, they'll put a little oxygen nasal cannula prior to the surgery. That's what we do too. So we'll pre-oxygenate these cats for 10 minutes. So anesthetic risk is a good question, but it's something that we take precautions for because it's the senior cats who have the health problems that might need the surgery. Did you have something you wanted to add?
No, I just scratched my head. I'm sorry.
I saw you got a part of my eye. Okay. This is new technology to me, so pardon me for wanting to. So at home, cats, as they grow older, are more likely to stay indoors. They recognize that they don't see as well. They feel safer inside. They don't thermoregulate the same way, so they want a nice warm environment. You know, so they're a little bit more likely to kind of retire. Well, what does that mean? It can mean that they don't have enough to do. And stress comes really from boredom as much as it does from introducing a new dog into the house. So one of the things that becomes more of our obligation as the owners of senior cats who are now have decided to retire is to give them something to do. So very often we have to think differently about that. The other thing that makes a big difference is that, as I said earlier, all these cats have mobility issues. Once they get over 12 or 13 years old, they're not going to be tearing up the stairs anymore. Now in California we don't have very many stairs, so we don't have to worry too much about that. But I do have people who have basements, and because they don't like litter boxes, they stick the litter box in the basement. And then complain because their cat doesn't go down and use that. So we have to think differently about the environment that they live in. First of all, to make it interesting, give them something to do, and then make gradual changes. Cats hate change. Have you ever noticed when you get up in the morning, your cats will go out and make sure that everything is the same as it was before they went to bed last night? They absolutely hate change, and with good reason. They're solitary hunters, and they have a territory when they live in the wild. So these are, once again, the same cats, right? And they need to feel as if they know everything there is to know about their environment in order to feel safe. So the first thing my cats do when they get up in the morning is they go out and run to the top of the cat tree, make sure everything that they can see is the same way as it was before. I made the mistake of rearranging my living room not too long ago. I put we took these two easy chairs and moved them to one side. We didn't make big dramatic changes. I put a little table over here, and I put the chairs that were over there. It took them an hour to investigate, to make sure that it was going to be safe for this new environment to be that way. So when we change things in the house, we want to make these changes kind of gradually so that they don't become a stressor, right? If you know, what about when you go on vacation, you start getting the suitcases out? Yeah, it's pretty stressful. They hate that. They hate that. So those are the kinds of things that when we make these kind of changes that I'm going to recommend, that you make them slowly, give them places to, for example, I'm going to show you some examples, but one of the things that these cats need because of their arthritis is a little extra heat. So a little heated bed is really kind of nice. Giving them a different way of getting to places, and I'm going to show you some examples of that. The other thing we're going to talk about is litter boxes. And I told you a little bit about them losing vision. A lot of times people will tell me that their cats really are very vocal at night. Like 3 o'clock in the morning they're making these crazy noises, right? Some of that can be the fact that they don't see as well. So they're not gathering light as well and reflecting it on the retina. So I just suggest you put on a night light. So sometimes that works, and I'll tell you about a couple other reasons why they do those things. Yeah.
I read an article recently that I saw that about heat, one of your bullet points. It said that cats prefer an ambient temperature something like 90 degrees Fahrenheit. Wow. Is that true?
Around their body, yeah, they do. Most cats, not all of them. Some of the heavier coated cats don't particularly.
Wow.
But yeah, they do like warmth, and especially when they get a little bit older. There's one of the things that I think is really unfortunate is that people pay a lot of money for litter boxes. Litter boxes are made out of plastic.
$78?
Well, it's $78 for 10.
Oh,
So that's $7.83
okay.
each. The reason I like these are just things I pulled off of Amazon because I didn't want you to think I was trying to sell anything. These are my favorite kind of litter boxes. They are big. Cats like big bathrooms just like I do. Cats also don't like to eat in their bathroom, so put the food bowls a long distance away from them. These litter boxes are just the same plastic as the $40 one at PetSmart, and they are porous. And one of the problems of porous materials is they pick up odors. So you put enough urine in a plastic container for 5 years, and that thing's not going to smell so good. Well, cats have a really extraordinary sense of smell. So if you can smell a little bit of odor, they're overwhelmed by it. So very often, I can simply solve a problem by telling people to go buy a litter box. But don't spend $40. Go out to Target or Home Depot. They have these kind of under-the-bed clothing storage boxes.
Someone's behind you.
Hello. Hi.
Hello? Oh, wow.
You're not usually here today, so.
There we go.
No, no more about signature, we're good.
Okay, thanks.
These are litter boxes.
So these are under-the-bed clothing storage boxes. They have covers. Discard those or put them underneath them.
Is this the larger one?
These are 28 quart, I think. Yeah, 28
Yeah,
quarts.
because they have the smaller sweater ones and then they have.
Yes.
This is the large one?
This is the big one, 28 quarts. It's big.
Oh.
It's like this big.
Oh, yeah. Okay.
I used the lid behind it.
Oh, as a backsplash? Yeah. Good idea. Good idea. Because here's the other thing. One of the things that happens with these guys is they have a little trouble getting up and over into these big deep litter boxes, right? So one of the things you can do is cut down the side. Take a big pair of big heavy shears, and you can cut down the side. Well, what that ends up happening is you get a little bit more litter outside the box. There it is. There's one.
I get to be the band.
The band of cat litter boxes. Here we are. So that's what we use. I have two cats of my own at home. And the third one you're going to meet in a little bit.
I just bought two because I just did mine last week. They were at Target. I think they were $6 tops, and the litter box was like 13 or something for a little smaller one. So they're in the back corner of the storage in Target, and there was a whole bunch of them.
So replace your litter boxes every 6 months to a year, and buy the cheap ones. Cut them down if the cats have a little bit of mobility issues. Just cut the narrow side down a little bit so that they have a little easier way of getting inside. These are just a couple of different things that we were just talking about heat. One of the things that is a risk of having something heated is if you have to plug it in, you can always have a little problem with electrical issues. So Snuggle Safe is a microwavable. It's hard, so you have to put it under something soft. But you microwave it for 4 or 5 minutes and it stays hot for 8 hours. So you can stick it in if you're going to try to give them a little more comfort by increasing heat. You can do, there's a lot of different ways to do that. But this is one of them that doesn't require plugging anything in. If you do anything different in your house, if you're going to rearrange the furniture, have house guests, introduce a new dog, your kids are coming home from college, they're going to be people coming for a party, plug in a Feel-Away. Feel-Away is the brilliant product. It's not, I have no interest in the company, but it's one of those things, when your cats rub up against you with their faces and say, oh, I'm really happy and you're mine and all that. That's a pheromone. It's actually placing a chemical on you. And that chemical was produced and put in a bottle and then put in a Feel-Away diffuser. So it's like aromatherapy for cats. So you can't smell it, your dog can't smell it. I've never been able to smell it unless I get right over on top of it. It's a way of keeping things calm and keeping the stress level down when you're going to make some changes. So it's the only actual product that I'm going to talk about in any detail because it's one of those things that everybody should know about, especially if you're going to travel.
Can I just do a testimonial?
Sure.
It worked so well when Buddy died, and Biddy was just alone for the first time in 16 years.
Yeah.
And it transitioned her into, I mean, just a normal,
I was just saying,
normal
John.
human being.
But that's how we feel about it.
Yeah, she really made that transition, yeah.
Yeah, so Feel Away is the only product that I'm going to actually really tell you, you need to know about it. And it's, I think we had some brochure somewhere about it. But it's one of those things that it comes in a spray as well, and we use that for travel. So when you are going to take your cat to come see us, you spray the inside of the carrier and the inside of the car 30 minutes before travel. And the reason you have to do it 30 minutes ahead of time is it does have a little bit of an odor because the alcohol diffuses the spray, and that alcohol needs to evaporate before it's actually useful. So that's the only thing. It just helps reduce stress a little bit, and I don't know about you, but the older I get, the crappier I get. Here's some other ideas that I found. One of the things we talked about is mobility. I've had people build ramps out of stair material that you can get at Home Depot. This is a little ramp that you can use to, if the cat sleeps on the bed and you want to train them to get up there, you just put a couple of treats on the ramp or on the stairs, and really high value treats, and teach them how to get up there in a way that they don't hurt themselves. A lot of people will say, well, he used to sleep on the bed with me all the time. He doesn't do that anymore. He sleeps someplace else. And really, if he would love to sleep in that nice warm bed next to that nice warm body, but he just can't comfortably get up there anymore. Yeah.
I built, I'm not a carpenter kind of person, so I just took boards that were about 6 inches wide and maybe 5 or 6 feet long, and I ramped up to my dresser with one board, and I put carpeting on it so we had some grip. And then I put another board from the dresser to the bed, so he has a little
That's wonderful. It's a perfect kind of cat person. So, it's a matter of recognizing the fact that while they're not going to let on that they actually have painful joints, they won't limp, they'll just change their lifestyle. So they'll just stop going places they used to go. And so if you can help them go to the places they want to be with a little bit of extra furnishings, I think that's wonderful. I love that idea, to actually create a little accessibility to so many different places. This is a heated bed. It's a nice idea in that it's a place where cats can actually go. I don't keep my house, I'm married to a skinflint. He's standing right there. So the house isn't kept real hot, so we have heated beds for the cats. So it's just another way of giving them the ambient temperature that keeps them more comfortable. These are some other ideas. There's night lights with sensors, so you don't leave them on all the time. They just come on with motion detection. So you're just saving a little money that way. And this was brilliant. One of the things that I think is a problem for older cats is they really do still like to get up high. This is a senior cat tree. The accessibility starts very low to the ground, so they can actually get up. They don't have to really jump. So thinking about your cat tree and the change in mobility of your cat, you may find that first step is really too high. So I thought that was really kind of brilliant, and because in thinking about how cats like to get up and observe their surroundings, that never changes. They might not do it anymore, but they don't do it now because they can't get there. So it's really an interesting thing to consider, a different way of getting up high.
Did you find this on Amazon as well?
I did. I was just hunting around for ways for mobility things, and I'm not advocating this particular cat tree, but just think about the distance that those cats have to go vertically to get to that first part of the cat tree. Yeah.
Do you think they'd have that ramp, like over at PetSmart or?
Probably so. I'm sure they do. In fact, there are a lot of different ways to do it. I've had people just take a couple of cushions from the couch, pillows, and just put them at the bottom of the cat tree, so the cats can walk up to that first ramp. Because usually it's pretty easy after that. It's often that first step. So just think about different pillows, or put a little step stool or something that gives them access. It's just a way of thinking differently about getting them to the height that they want to get to without having them be uncomfortable. So here's some of the things that people tell me happen. One of my cats that you're going to meet in a little while has developed this really amazing resonant holler. And it's partly because he's deaf, so he can't hear himself. And his vocal cords are changing because he's old. And it's just deafening.
Yeah.
You know, and so those are the kinds of things that can happen. Another thing that you might, it might be helped by a nightlight is I've had patients, cats who get kind of lost in corners, you know, and they'll face a wall and start to howl because they can't find their way out, or they're, you know, they're just getting they're getting a little bit, a little cognitive dysfunction is one other way to put it. And then the other thing that can happen is that their personality changes. Now, Woody, when I first adopted him, he was about 4 months old, and I wanted to make him a house cat. I had always wanted an orange tabby cat because I thought that every orange tabby cat on the planet was sweet and lovable and liked to sit in laps and things like that. So Woody taught me that that's not the case. I also tried to make him a house cat. He then tried to kill me. And from the moment he came to live with us, he was not my cat. He hated me. If I kept him in the house, he peed on my shoes, he'd go in and destroy stuff in my closet. He wouldn't have anything to do with me. He loved my husband, and they have a wonderful relationship. And the interesting thing now is that he has some age-related cognitive dysfunction. He has forgotten that he hated me. So now, if I sit outside, he will actually come and jump in my lap and ask to be petted by me. So some things change for the worse.
What was the sleep-wake?
Oh, sometimes you'll see a difference in sleep-wake cycle, and that is that usually when you went to bed at night, they went to bed. And sometimes that changes. And it happens to people too. They start having more difficulty with insomnia. So I think there are some neurotransmitter changes that happen in aging where these cats actually do have these sort of alterations in sleep-wake cycles. The other thing is that cats are nocturnal. And so one of the things we have to do is keep them busy when we're busy so that we can change their, and that's true of all cats. We need to get them to be busy while we're busy so that at night when we want to be left alone in peace, that they're not up tearing up the house at 3 o'clock in the morning. So that's a really important consideration for all cats, actually. That's Grumpy Cat, for all of you who don't have the internet. He's everywhere.
Yeah.
So up until the time these cats are about 10 or 11 years old,
Oh my God.
that's a very interesting body shape.
Did somebody bring their cat into you to do that?
No.
Although we have done mohawks.
We have done mohawks,
Not that.
but we haven't got this one down. So after you neuter a cat, you know, all of my friends who are going through menopause complain that they're gaining weight. Well, at the time that we neuter our companions, we get rid of the hormone-producing organs, right? So a female, both male and female, their calorie requirement decreases dramatically at the time that we spay and neuter them. And it decreases until they're about 11 years old. And that's why I am constantly talking about how you feed cats and all that, because a lot of them are fat. And they have the same kind of health challenges that we all have from being overweight, the risk of diabetes and heart disease and all those other things that doctors tell you about. It's the same thing. The interesting thing that happens at 12 years old, and at 12 years old, the 12-year-old cat is somewhere in late 60s or so, 65, 70, something like that in human years. Their calorie requirement begins to increase. They also need more protein. So one of the things that we see a lot of is the senior cat diets, and it's one of the reasons why I'm going to talk about nutrition all by itself. Cats should not have their calories restricted when they turn into senior cats, because their calorie requirement goes up, just like it does in humans. they also have an increased need for protein. So when you see senior cat diets in